So before we get into DKA, let's make sure that we remember type 1 diabetes. And of course, like all these tutorials that you request, it's going to be short and sweet. We want to make sure that we get the concept, right? So type 1 diabetes, we don't have insulin available. So all these I's, this represents insulin, okay? Our S's are going to represent our blood sugar, blood glucose, and then these red dots are going to represent the cells of the body. So we need to have insulin in order for our cells to use this sugar for energy. That's what we need. So how does that work? So insulin allows this sugar to enter this cell so that the cell now can use it to do something, right? To carry out a function. It uses it for energy. Well, in the event that we have type 1 diabetes, that means we do not have insulin available. And so then that means that this blood sugar that we have hanging out, right, circulating around in our serum cannot be utilized by the cells. And so it's just going to build up and build up and build up and build up. And that's bad news. One of the complications that can occur is DKA, Diabetic Ketoacidosis. And this can happen when there's not enough insulin on board because the type 1 diabetic person is not taking insulin like they should be. Could be because an illness has triggered it. But whatever the case is, what's happening is that the body cannot utilize the available blood glucose for energy. So what does it do? Starts to burn fat for energy, right? Sounds good in theory, but when you burn fat for energy, it makes a byproduct that is a poisonous acid called ketones. And when those ketones build up, well, that's going to cause a problem in and of itself. These ketones can be very dangerous. Again, they are a poison in the body, and they can cause a lot of harm. So one of the things that occurs when our blood sugar starts to rise in the event that we're this person with type 1 diabetes is that at about 240 to 300 starting point or above, we are at risk for developing diabetic ketoacidosis. So this would be our blood sugar level. If we get a blood sugar level that gets to be this high, we are now at risk for DKA. The body is going to try to compensate as much as it can for this high blood sugar, which is why we see things, as far as signs and symptoms are concerned, we see things like increased urination, right? And increased thirst. So why does that happen? Well, the blood sugar starts to spill over into the urine, and our kidneys are just going to dump it out, dump it out, dump it out. In addition to the blood sugar spilling over, however, we're going to start losing some of our solutes too, like potassium and sodium. Those things will end up going. So as we have this increased urination, as our kidneys are just getting rid of the sugar as they can, then we become thirsty, which is why we see polydipsia and polyuria. And these are some of the early signs and symptoms that we'll see in somebody who is hyperglycemic. As far as DKA goes, we're going to see these same type of signs because, of course, we are hyperglycemic, right? We're going to see nausea, vomiting. They might be complaining about really severe abdominal pain. We may start to see things like our Kussmaul's breathing. Let's put that here because that's an important point. Kussmaul's, and you probably remember this. Let's write that here. Kussmaul. This is an important part of our DKA conversation because this is this irregular, deep, labored type of breathing. It's like an extreme hyperventilation. And this occurs because, again, DKA, right? Diabetic ketoacidosis. This person's in an acidotic state. Hyperventilation is one of the compensatory mechanisms that the body will do to try to blow off, if you will, or get rid of all that extra acid. Another thing that we might see would be, or observe rather, fruity breath, fruity smelling urine. Again, these are signs that ketones are present. So what do we have to do for this person? Well, we need to treat the problem, right? One, it's going to be diagnosed by checking the blood glucose level. Again, having a blood sugar level of 240 or above. Normally 240, 300 would be our high starting point or above is our risk factor. Checking the pH of the blood and seeing that we have low pH. We can check to see if we have ketones that are present in the body, specifically in the urine. And these are going to be some diagnostic tools to help us identify this person is in fact in DKA. So how do we treat this? Well, if this person has excessive urination, they're going to be at risk for dehydration. So we definitely want to give IV fluids. We want to make sure that we are rehydrating this person. In addition, with this high blood glucose level they have, we want to give insulin. And that's primarily going to be given IV. So we'll give IV insulin to this individual until we can get that blood sugar under control. Another thing that you would see in this treatment is going to be potassium. We may be giving this person potassium as well. And you might be thinking about, well, why would we do that? Well, remember back to our kidneys dumping out our blood sugar, this excess blood sugar, and the solutes with it, the potassium, sodium. So we could be hypokalemic now. Also, insulin can cause hypokalemia because insulin actually pushes potassium back into the body's cells. But if we are already low to begin with because we've been dumping it out in our urine, then we can decrease that number even more with the administration of insulin. So giving potassium is a really important thing to do as well. So for you as a nurse or a future nurse, even a nursing student, and what you really want to make sure that you're looking out for is thinking about the signs and symptoms that you're going to see in this individual, thinking about the treatment that we have to do for this individual, and understanding some of the risk factors that can play a role into DKA developing in a type 1 diabetic. Now, we're going to talk about another complication of hyperglycemia, and that is HHS. So I'm actually going to delete this down here because we're not going to talk about Kussmaul's in this one. I'm just going to put HHS in this bracket. Now, you might know it as HHNS. You might have seen it as HHNC. There are different abbreviations for it. But this talks about hyperglycemic hyperosmolar syndrome. And we see this in our type 2 diabetics. So as far as these complications go, DKA is something that we would see in type 1 diabetic patients. Very rarely would we see it in someone who's type 2. And type 2 diabetes, its equal complication, if you will, is going to be HHS. So we just talked about how a blood sugar level of 240 to 300, that starting high point, that would really put somebody at risk for developing DKA. Well, in someone who is type 2 diabetic and somebody who's experiencing HHS, that starting high point is much higher, around 600 or above, puts them at risk for HHS. Now, a lot of the signs and symptoms that we see in HHS and DKA overlap, with the exception of ketones being present and the level of dehydration that can be present. Now, I'm going to erase these X'd out I's because in someone who is type 2 diabetic, they in fact do have insulin, but they can have cells that are resistant to the insulin's function. So maybe we have the right amount of insulin, but our cells are just not responding to it. And maybe we don't have enough of it, but we do have insulin present. And that's what would be a distinct difference between type 1 and type 2. So let's put these I's back. So in HHS, essentially what's happening here is a very similar problem to DKA, hyperglycemic, right? We have high amounts of blood glucose in the body, and the compensation is going to be highly the same. However, because our blood sugar level is so high, our kidneys, right? The blood sugar spilling over to our kidneys, in addition to the solutes, we're going to have excessive urination. And so this person can become very dehydrated very rapidly. And because we have this excessive urination and this excretion of fluid, right? We actually are pulling fluid right off of our body and out of our cells, and it makes our blood thicker. That's our hyperosmolar part. So our urine's going to be really concentrated with these solutes. And because we're losing such a large amount of volume, the blood becomes thicker. So that's our hyperosmolar. Now, as far as how we want to treat this, the treatment's really going to be largely very similar to what we do with DKA. IV fluids, right? Because this person's going to be at risk for dehydration. Insulin to bring this blood sugar down, and potassium for the same reasons that we use in DKA. Some of the signs and symptoms might be a little bit different. So what would overlap would be the polyuria, polydipsia, right? Peeing a lot, going to make you thirsty. You're trying to chase that loss, if you will. But we might also see things like confusion and dry mouth in this person, and signs and symptoms that we would identify with someone who is really grossly dehydrated. And so it can be a little bit more dangerous as far as the dehydration level goes. Both of these complications are very serious in the type 1 or type 2 diabetic patient. So very quickly, a little test-taking tip is, if you're learning these concepts now, of course, these are just the basics for you, but make sure that you know, especially in a testing scenario or in a clinical scenario, the important things such as identifying the signs and symptoms, understanding why this polyuria, polydipsia is happening. What does that mean as far as the blood sugar is concerned? Knowing that if somebody presents with polyuria, polydipsia, they're complaining about abdominal pain, and you're speaking to them and their breath has this fruity odor to them, we start thinking about things like DKA, right? Someone has a really dry mouth, their blood sugar is 650, they're peeing a lot, they seem very confused, they don't have a history of taking insulin at all, but this looks like a problem with hyperglycemia. Of course, then we're thinking maybe this is type 2 diabetes. So make sure that you know your signs and symptoms. Make sure that we know our treatments for it. Replacing the fluids, giving the insulin to bring down the blood sugar, why potassium administration is important in these cases. So those are going to be really important things to remember, especially when you have tests that are presented on this material, when you're trying to critically think, why is it that I'm giving this person potassium? Why is it that I'm giving them IV fluids when the problem is just their sugar, right? No, it's not just that. So again, that was DKA and HHS.